So that's what the OneMindSet Foundation here, something that can continue to go no matter the incident or the crisis. We almost like a service. So like the same way you'll see AT&T pull up with a cable, you know, when you see AT&T, they coming in to put in Wi-Fi. Well, you can see OneMindSet, we come in to uplift and make change in the community. And so that's the point of our foundation here today.
My dog. What's up? Hold on, let me get it right. Yes, sir. How you been?
What's up, man? I'm good, man. How you feeling?
Man, hey, blessed and highly favored, can't complain. I'm trying to make sure.
Yes, sir.
I know it kind of boom, boom. There we go. But man, I really ain't talked to you in a while. It's been a minute.
It's been a minute since,
man,
what, 2014, 2015, something like that?
Man, for real, what? Man, like 7 years? That's what, high school?
Yeah.
Hey, we getting old. Man, hey, but basically, man, why I wanted to bring you on, because like for my foundation and what we're doing, not only for Black History Month, but for months to follow, we just bringing up figures on people that grew up in certain conditions, that had to go through different adversity to get to where you're at now. Just to shed light that it can be done. Shed light on the possibility that just because you may be Black or that you may be coming from an under-resourced community, that the goal of possibility of becoming something bigger isn't such a big thing. You just got to take the time to do it. And so just having people like you as yourself, especially with your story and how you went about it, because your story is different from a lot of other people, and just how you went about it, and the success you brought with it. And so that's one I just wanted to share light on today and speak on. But before I do that, and I like you speaking yourself, I was want to bring up some percentage, being that the field that you're in, just bring up some of the percentage of people that's in your field and just the lack of people that's in it. April 21, 2021. I zoomed in. I got this from April 21, 2021. The Health Day News. It says the percentage of U.S. doctors who are Black has barely risen in the past 120 years. And there's still a wide pay gap between not only white and Black physicians, but in the whole disparity. A new study finds that the analysts of U.S. Census Bureau data from 1900 to 2018 include about 150,000 physicians, with about 3,300 Black male physicians and 1,600 female Black physicians. This study's finding demonstrates how slow progress has been and how far and fast we have to go if we care about not only diversity of physician workforce and the health benefits such as diversity brings to patients, particularly in minority patients. And another study done by Dr. Dan Lee, assistant professor of medicine at the University of California, in 1900, almost 12% of the U.S. population was Black, but only 1% of physicians were Black. And then 40 years later, 1940, the population at that time was 10%, but of the Black physician was only 3%. Then they did a study again in 2018. 13% of the U.S. population were Black, but only 5% of the physicians were Black. Of those, were 2.6% were men and 2.8% were women. Being that the Black women position increased almost 3 percentage points between 1940 and 2018, the proportion of physicians who are Black men remained essentially unchanged at the time, according to the study, while also the pay remaining the exact same. And so from there, that's why I wanted just to let you just talk about yourself, and just some of the accolades you have and who you are exactly.
Oh, man. Where do I start? So after football at Bird, I ended up committing to Grambling. And the reason why I ended up committing to Grambling was because they were offering outside, like a full scholarship with athletics. Outside of that, they were offering full academic ride for that first year, as long as I kept my GPA above a certain level. So that was a no-brainer from that point. And of course, my family has ties to Grambling. Grandmother still works there. She's a professor in the education department. My mother went there. I had an aunt that went there. And just a wide range of family members, ranging from cousins to uncles, everybody. So during that process, that was more so just me wanting to kind of stay close to home, and also just stay in touch with my roots, man, for the most part. So going through Grambling was able to be a part of Kappa Alpha Psi Fraternity Incorporated. Was also able to be a part of the biology department, as well as being in the biology club. What else, man? I was a part of the Meharry intern BSMD program, where I went to Nashville and spent a couple of summers, 3 summers, in Nashville at Meharry. Just learning about how to become a doctor, what it takes, the scores that we would have needed to make for the MCAT. After that, of course, was playing football for the first couple of years at Graham. Ended up running into a problem with cardiomyopathy where my heart got a little bit too big. The ejection rate kind of went down. And so I had to stop playing football due to those health complications. Right at the time where I was starting to get some burn, man. So, that was kind of a tough hit on me, man. But again, one of the big reasons why I committed to Grambling was because they were offering that academics on the side of football. So it wasn't like a big fall off between football and, just me trying to figure myself out outside of the field. I was still able to keep part of my scholarship and work on the team as an operations manager. I helped film. I still traveled. So I was still a part of the team, man. After that, took my MCAT, got my scores back. And during that time period, I was going through sort of like I wouldn't say a cognitive dissonance, but I was kind of going through like a conundrum, a dilemma between, do I want to go into medical school like directly, or what other avenues can I take? So after talking with my parents, after talking with a couple of my deans at the school, and after talking with my mentor, who I was just on the phone with them, a few hours ago, I came to the decision to I've always wanted to be a doctor. Came to the decision of, instead of going into med school, I would go into chiropractic school. So that way I can still be a part of the healthcare field, still have a specialty, still be a part of, just serving the community, serving the Black population, and also serving the complete population. So made the decision to take the route of chiropractic over the medical route, just so I can have my hands on people, touch people in a different way, as far as that energy transfer, just let people know, like, man, I'm here for you, instead of just pushing pills. And not saying that medicine is not necessary.
I'm going to cut you off a bit. That pushing pills, that component in football, man, that's almost, that's deep for real, bro. And that's like a little bit of how I got to this journey and how I stepped away from the game of football, because I was at that point too, where I was like, man, I don't want to keep having to take certain pills just to be able to practice. I don't want to keep take certain pills just to be able to just to work out. You know what I'm saying? Eventually, start that mental break on your head really really start affecting you. Like, man, just to run, just to walk, just to play, I got to go through certain things. A lot of people don't see that side of the game of football. Man, that's a physical game, and you putting your body through a lot. Especially coming, like you said, you had a heart condition. I had my Achilles injured. And so being able to come on that field every day, that took a lot. Mentally, I had to come 2 hours, practice at 6. I'm up at 4 a.m. and practice at 6 because I got to stretch. I got to take a certain pill by this time for it to wear in on the body. I got to do a certain massage. I got to do all this just to get this just to run. And with the Achilles, man, they're going to burn off in 30 minutes. Within an hour, 30 minutes of me going, because you on the field, you got to go full speed. So I'm going full speed out of 30 minutes to hour. Man, that's going to wear off. I got to what I got to do again. I got to take some again just to be able to go through that same routine. So I know exactly what you're saying when it comes to that component.
Yeah, man. Dang, man. That's tough. That's tough. I just had a influx of memories, man. Just having to go through that treatment regimen with the carvedilol and lisinopril. It was tough on me. So the transition from playing football to trying to figure out what I wanted to do with the rest of my life, man, it wasn't as hard as other people's transitions, because again, I still had academics to fall back on, but at the same time, it did take a lot out of me. It did take a lot of just steadfastness, just praying, man, honestly talking to my people, talking to my friends, my bros. So yeah, man.
Just from your spiel, these questions I have, I kind of want to push into a side, because I like when I talk, I like to vibe with it, and just and I want to connect with it to where it resonates to, because like I like to take these videos, you know, freshen them up, put them on YouTube, and when I do like a mentorship program and stuff, I like to show it to the kids. So I want to take that vibe and show them like, man, like this game we play, no matter what sport, eventually injury may come with it. Not to wish it on nobody, but you can't stop statistics. You can't stop. You can't stop it, you know. And just to show, like, even though these events happen, man, it's still possibilities of you to be more, of you to go further. Know, like, you're not the first one to go through it. You won't be the last, and you don't have to do it alone. And so from that standpoint, I want to ask, just like from your transition, that was really my second question. How was your transition from an athlete into the medical field? And so from there, I want to speak on, like, how was that transition and who helped you along the way in order for you just to be able to, man, like, this game of football, it's not, yeah, it was taken from you from a standpoint you said. Now I got to just focus on my academics. A lot of times we speak on that, but it's hard to do when you know it's a passion that you love. And so how was that journey for you?
Well, so starting off, like the very first person, like outside of my parents, man, the very first person was Coach Fobbs, actually, at Grambling. He sat me down one day. He brought me to his office. He sat me down. He was like, I've experienced this before. Like, he's had a player before that had a condition, ended up getting into some health problem, like some health trouble on the field. And I'm not honestly sure I remember exactly what happened to that particular player, but I don't think that it was good. So Coach Fobbs sat me down. He looked me dead in my face and he talked to me like man to man, heart to heart, and was, you know, showed his concern. And so from that moment, like, he honestly gave me the choice. If I wanted to keep pushing. If I wanted to, you know, still stay around the team, but kind of take a step off of the field, then I could still do that. And that was the route I took because of just the conversation that we had, man. I didn't want to be out there running a slant route, you know, and then all of a sudden just collapse. And then understanding the type of the condition that I had, I didn't want to risk it, man. You know, I had stuff to fall back on. You know, football and sports isn't the end all be all. So from that point, you know, further discussions with my parents and my family, that led me to wanting to talk to my dean at the school, Dr. Hill. And Dr. Hill, actually, and that's crazy because the day that I walked into Dr. Hill's office to talk to her about whether if I should go towards taking, like, you know, applying to med school or going to osteopathic school or any other options, because at the point I didn't really understand chiropractic. I didn't know what chiropractic was outside of just, you know, go get adjustments, your back hurts, your neck hurt. And so walking into her office, lo and behold, is my mentor, the man that actually convinced me to take the step and go into chiropractic school. He was sitting in the office talking to her, and the reason I was in the office was because I had a fraternity meeting to get to, and I couldn't go to, like, when he was getting ready to talk to the whole biology department. I couldn't go to that meeting, so I went to her office beforehand just to talk to her, you know, ask her questions about what was going on, the information that they were giving, and he happened to be in there talking to her basically about the same thing. I walked in as they were mentioning my name, you know, so it's kind of like a sign, man.
Yeah.
Really, like, you know, really ethereal. So coming. So after that, I did the application, filled that out, man, and I swear I was probably accepted into the school the same week, a week later. So just honestly, that moment there is what made me, like, just plant my feet and say, okay, I want to take this path. I've been asking for a sign, you know, I've been talking to all these people, I've been trying to figure out what I want to do, and this has been, like, right here, right in front of me at this moment. So I think that I should go this route. And man, I would never say I regret that decision. Like, that was, right now at this point in my life, I can say that was probably one of the best decisions I made. No cap, like, for real.
Yeah. And, like, not to take away what we was talking about, but just to piggyback, I want to say the same thing. A lot of people, I get asked, especially when I go back on the Shreveport, I get asked all the time, like, man, you don't want to go to the NFL? They had the new draft too, the USFL draft. They be like, man, you don't want to try to step into that role? I be like, nah, dog. I be like, I don't need it. Like, because, like, what I'm doing right now, I just know it's way more impactful than just a game of football. Even though it's fun, you know, it comes with money, but it's something more better when you're pursuing your soul. It's something more better that comes with that, you know, just finding your actual journey and something that can last for a life. And so I know what you mean by that. Like,
Mhm.
just saying like, yeah, you at the part where I like what I'm doing and I enjoy it and I want to keep doing it. And so from there, how long was that journey for you to be where you at now? Being in the medical field, you in Oregon, correct? I was doing
Yeah.
some, yeah. So you in Oregon. So talk about that, the journey, and why you in Oregon.
So, man, so I spent the past 4 years in Atlanta getting my doctorate, and
Yeah.
towards the end of my time in Atlanta, well, let me backtrack. I would say about a year or so before I was getting ready to graduate from chiropractic school, I ended up getting a job in this personal injury office with this one chiropractor, Dr. Sean Jones, at South Fulton Regenerative Medicine. So just working with him I was working with him for about 3 months before I picked up a second opportunity in another clinic working with this Dr. Kevin Flight, who was also a new, who I wouldn't say specializes, because we'll get to that later. But for the time being right now, I would say he specializes in sports chiropractic. So I was able to go back and forth. Mondays I was with Dr. Jones, Tuesday I was with Dr. Flight, Wednesdays, Thursdays, Fridays, back and forth, getting the best of both worlds as far as chiropractic goes. So during that time, was able to expand my expertise, kind of jot down exactly what I wanted to put on my resume. Gather as much information from them too as possible as far as the profession goes and how to maneuver my way through the profession, how to how do I put it, like kind of which steps to take, which direction that I wanted to take, because again, I didn't want to just be sitting in the office being a technician, just giving one patient this type of adjustment, giving that patient that type of adjustment. Like, I actually wanted to be out there in the field, like getting it out the mud in a chiropractic sense, for lack
Yeah,
of
I
a
get what
better
you're saying.
term. So during that time, I was just applying places, Maryland, Florida, Georgia, Texas, Colorado, Oregon, Alaska, New York, man, just
Was it
all over the
Alaska?
country. For real, man, like just all over the country. And so, there was one particular vision that I wanted. I just wanted to be able to work in a total clinic. I wanted to be able to work with people who understood musculoskeletal conditions, people who understood like sports science, people who just wanted to take chiropractic to a different level
Hmm.
outside of just being a technician and giving adjustments all day, every day. And so during that
So I got
part,
a question from there.
yeah, yeah, yeah,
So you saying that you wanted to take it from a different level. So you saw something that you wanted to do, and you saw
yeah,
like I know why you did that too, because it's that athlete in you too. So you saw
yeah.
something you wanted to do, but you was like, man, I want to excel at doing it. And so you wanted to take it a path that nobody ever seen before. And with that being like, explain a little bit about just your vision of like, just explaining on what is I can't say the word. So what is chiropractic? Yeah, I
You
can't.
good.
It got tongue tied on me. But what is it? And then from there, explain your vision that you see with it. Because a lot of times I hear what you're saying, but some people might not understand when you say, that I can't see you saying words. That's not my field. But just explain it.
Um, man. So how do I put chiropractic, man? So chiropractic is the word actually means like hand practice. So you're practicing with your hands.
Mm-hmm.
So chiropractic, it's really a vast field, and there's not like one thing that I can pinpoint and say, well, this is what chiropractic is. Honestly, chiropractic is whatever that doctor wants it to be, if that makes sense. So that's why sometimes you see those chiropractors who just give adjustments all day, neck crack, back crack, mid back ribs, this, that, and the third. And then you have those chiropractors where you see more of a physician approach to it, where they do ortho exams, functional exams, neurological exams, lab work, and all of those things. And so the vision that I wanted to kind of incorporate and encompass within myself was being able to be that technician, because a lot of people who just see, oh, my neck is cracking, my back is cracking, like, I want my neck crack, I want my back crack. Like, a lot of people that see that they just see that part of chiropractic, um, which kind of honestly, it kind of degrades the profession, because we are able to do way more than what you see on
Mm-hmm.
YouTube or what you see on TikTok. So on the back end of that, being able to work in 2 different offices, I was able to see PRP injections, like basically just stem cell plasma injections that if you have like some arthritic changes or degeneration, that you can put in the joint line, and over time it helps regenerate those joints and lost tissues. Being able to see that, which you won't see in a regular chiropractic office, being able to see people see injuries where people come in with separated shoulders, people come in with dislocated joints, whatever, and then having chiropractors and physical therapists actually work and rehabilitating those injuries. So being able to see from both sides of that coin really just opened my mind, and I was like, dang, I just don't want to be sitting in the office adjusting all day. I actually want to be in the field and seeing different injuries and different complaints, and being able to actually help the patient, not with their symptoms, but treat the actual complaint. And so, yeah, so to answer the question, like the type of clinic that I always envisioned was a total clinic where we have licensed massage therapy, where we have acupuncture, where we have physical therapy, on top of maybe a medical doctor on staff or a physician's assistant, so we can do the injections as far as those natural injections, not any type of ESIs or those type of injections. But yeah, it's like a total clinic where a patient can come in, and it's, I don't want to say a one-stop shop, but a stop shop where you can get 90% of what you need, and that 10% that may need surgical consultation or any other consultation, we can just refer you out. But we've already done the exam so thoroughly to the point where there's no, what's the word, like dichotomy in regards to the treatment plan.
Oh, got you. Okay, so
Yeah.
So we see your bigger picture. So we got your bigger picture, and we got exactly what you do. And so from there, I like to treat it like a tree. Like I learned that the best way to learn something, you got to understand the roots of it, and then from the roots, try to break it off and try to break down the pillars. And so from there, I got your bigger picture. So I got the tree. So I'm gonna break it down from the branches all the way down. So
Let's get it.
Let's get it. So one thing I want to get on is we all know about the medical, the workforce and medical force, but how often do you see people that look like you inside your workforce?
Well, let me put it like this. While I was in Atlanta, every day.
Every day. Yeah, that's Atlanta.
Every day, all day. But since I've been out here in Oregon, we see about 3 to 4 African American or people of color patients about a week. We do have a higher Latino population than we do African American population out here. But again, it's Oregon. Different states have a different philosophy towards, colors and stuff like that. So it's not like we are neglecting that population. It's just that population isn't as prevalent out here. Because again, the African American and people and persons of color patients that we have, man, we give them excellent care. We give everybody excellent care. But when it comes to those patients, we try to tailor it to making them feel as comfortable as they would feel in their own confinements at the office, because again, it's not as prevalent out here. So when they do walk into the clinic, we have there's just an extra sense of, okay, let's make this person feel as comfortable as possible, because we know what it's like outside. So yeah.
The only reason why I asked that is because I want to say, we all know the saying that when you see inside the workforce, it's not about what you know, but it's about who you know. And I know they might be different for like the medical field, because you do got to know what you're doing. But for the same time, in order to get that job, you got to know people inside. So my question be, how's that process, knowing that being they only make 3% of the current workforce of the medical field? How's that process of knowing people inside the medical field?
To keep it a buck, there's a little bit of affirmative action that's a part of it, just a tad, just a tidbit. So I'm not going to act like me being black didn't kind of give me I wouldn't say an advantage, but give me like a cultural advantage over some other candidates. But what I will say is that this particular position I was in, I had only met these people once, and I didn't know the clinic director, I didn't know any of the staff members or anything. I had one phone conversation with them. They flew me out after that, and then I just loved the type of model that they had, and so I committed to being here for a time. So with that being said, I want to just set that aside for just my personal experience. But while I was in Atlanta, again, I had a mentor, and he was linking me with black doctor after black doctor after black doctor. So it was, so I was able to build that network. I was able to meet a few of them, man, and those clinics and those doctors, man, they're amazing. And it's crazy because there's not a lot of black chiropractors around, and there's not a lot of black medical doctors around either. But so being able to just be in that part of the country and see exactly what chiropractic is for our people, that kind of influenced me and like drove me to come out here, step outside of my comfort zone, and expand my expertise in a state where chiropractic is viewed more as a physician. So for instance, in Oregon, chiropractors are chiropractic physicians, meaning that we have autonomy over treatment. We also have the knowledge base of certain pharmaceuticals that we are able to prescribe to patients. Whereas if I was in Texas or Louisiana or Georgia, I wouldn't have that type of ability because of how chiropractic is viewed in those regions of the country and the different laws. So to answer the question again, the reason why I chose to do what I did is so I can expand my expertise, expand my scope. And so when I did move back home, like the type of clinic that I would be able to run, people would like you said earlier, one-stop shop. It'll be that clinic where if you have these type of problems as far as diabetic neuropathies or any type of diabetics problems, or if you have musculoskeletal complaints, or if you have some just psychological things that you need to work through, like we'll have somebody there for you. We'll have somebody there to care for you. We'll have somebody there to not only care for your physical, but care for your mental, and make sure that you feel comfortable during that whole treatment plan.
I like that. So I heard you say come back home. So if the office you envision, you want to open it up in Shreveport, Louisiana, or just Louisiana in general?
The area, I haven't. So I've been trying to figure out the laws and parameters around building the type of clinic that I want to be able to build. So once I figure that out, then I'll be able to make sure, okay, I can put one in this area where it's a safe driving distance for, my fam, or this type of population that I want to cater to. Not too far out in like Oklahoma, you know what I'm saying, and then try to ask people from Shreveport to come see us, you know what I mean? So like that's really the caveat right now that I'm trying to figure out. But again, man, I got time. So once that plan and that vision is, coalesced is the way that I want it to be, I'll be able to answer that question better. But yeah, I just want to be able to move back home or build something in the area where people can get to, whether they're in Monroe or Shreveport or Dallas or Baton Rouge or Houston, you know what I mean?
Gotcha. So from there, like I said, I wanted to break it down. So we heard about your journey and what you want to do. And so from now, I want to ask a question. So how was the process? Because you kind of hit on a little bit, but how was the process of applying to medical school? So for people that may want to be a doctor, talk about that process and that journey of sitting there. Okay, I graduated with my bachelor's. So my next step, is that correct? You graduate your bachelor's, and next step is now I have to apply for my medical school. So speak on that journey. And then you can incorporate also the 4-year journey of your bachelor's and then applying for your medical school.
Okay. So the application process for chiropractic school is a little different than medical school. Medical school, you have to take the MCAT, and then you have to apply, and then you have to go through sort of like an interview process. Whereas chiropractic school, for the time being, you just have to apply and make sure that you hit the like GPA, course requirements, and all those parameters as far as that. There is another part of chiropractic school where if you want to have a specialty or a residency, you have to apply, and that part is
okay. So we're gonna hold off. I got a question with that.
Yeah,
so
yeah.
We're gonna hold
I
that.
know.
Yeah.
I was just I had to separate that for right now. But the process for just chiropractic school after you receive your bachelor's is not that extensive as for the time being, but that's not to say that it's just an easy process. You still have to get through those first couple of trimesters or quarters, and you have to pass those your boards, and you also have to pass like OSCE exams, which are I guess kind of like mid-program, like quarter program. I don't know the right terminology to put it, but if a program is like 14 quarters, then you have like a fifth quarter OSCE, a 10th quarter OSCE, and then like your last OSCE or whatever, to make sure that your scope is broad enough to be able to progress to the next part of the program. But the application process is at the beginning is different than what it is for med school.
Gotcha. All right, I had to keep myself on mute. They downstairs working on something. They going to work down there. But my next question was, what was the process of studying for your license exam? So is that the same with so with the specialty you in? Do y'all still have to do your license exam?
So with um, with chiropractic, studying for so there are two parts with chiropractic. While you're in school, you study for the national boards. So that's so you can be recognized by the NBCE or the National Board Committee that this person has graduated school. This person has also finished their board exams. So whichever state that they're in, they are eligible to take the exams for that particular state. Because again, like I said earlier, there are some laws different between state to state with chiropractic. So after you pass your board exams and you graduate in whichever state that you want to practice in, you have to take those particular tests for that state. And then, excuse me, what was the second part of that?
I just asked what was the process of studying for your license exam, and if this is like, is that something you can do based off of what you're trying to do? Because I know you like it's kind of different for each one, so I was just trying to make sure it was the same, maybe for what you. I don't want to say the word because I'm gonna screw it up, so that's why I just say for your specialty.
So the process of studying was, people had different processes, but the process of studying was we have 5 boards that we had to take: part 1, part 2, part 3, part 4, and then PT. So the process of studying for part 1 was more so me sitting down and reviewing all of my I guess basic biology and basic sciences that from freshman year in undergrad to like 4th or 5th quarter in the doctorate program. So it's just basically, I would say that would be the chiropractic entrance exam, part 1. So studying for that would be similar to somebody who would be studying for the MCAT. Part 2 would be more so studying for, I would say, things that pertain to chiropractic as far as the philosophy, as far as neurology, X-ray, those type of things as that pertain those type of like clinical factors that pertain to chiropractic. Then part 3 is more so like applying, how would I put this? Applying those clinical factors that you study from part 1 and 2 into like diagnosing differential diagnoses and treatment plans for patients. And then part 4 is more so like going and physically doing those things that you study for. So 1 and 2 is like classroom stuff. 3 is applying what you learned to the classroom to hypothetical clinical situations. And then part 4 is taking all of those together and physically performing those in front of a group of assessors. And then for PT, that goes along with part 2 and 3. So with the treatment plans, so chiropractic and physical therapy really tie into each other. So that's why you have to take a physical therapy board as well. And so that takes care of all of your national board exams, so you can be recognized by the nation as far as this person is ready to step into the field of chiropractic. On the back end of that, depending on the state that you want to get practice in, so say for instance you want to practice in Oregon, you have to take another exam in gynecology and proctology. And also you have to take the legal exam for Oregon, because again, you're allowed to do more and assess more things in states like Oregon. So it's kind of different from state to state, but national boards, make sure you do that while you're in school. And then depending on the state, you have to take their boards.
Got it. I love it. I love it. You sound like you had to go through a lot, but yeah, you did it. And so my question was, so I did a little research on my own, understood like the journey of just trying to become a doctor, to be Dr.Chop. I see the comments, they love some Dr.Chop. So to be Dr.Chop, I looked at the process. So my question was, how long was the process of graduating from medical school and then starting your residency? And so from that point, that's how you ended up in Oregon? Is that considered your residency?
Yeah.
Okay.
So right now it's like so the doctor that I work with now is a doctor who went through a sports medicine residency. That residency is a 4-year residency. You have to take a test, you have to take an assessment. So it's like real deal medical school. During that residency, you go through shifts like they do in medical school, though. You go through pediatric shifts, you go through musculoskeletal neurology, X-ray, what is like just pathology shifts. So you go through different areas of clinical presentations and all of those things. Well, right now I'm in sort of like I'm on staff as the chiropractic physician, but another big reason why I took this position is because it's sort of like a pre-residency. I'm going to be able to get my certification in sports chiropractic, the certification that you have to get before you go and get the diplomate in sports medicine, which allows you to do those extra treatments that I was explaining earlier. Um, so the process between graduation and being here wasn't that long of a process for me because, again, I was doing a lot of like leg work while I was in school, so I didn't have that big of a gap between getting out of school and starting my career. So that process, I would say that overall the process took about a year for me to be like completely comfortable in taking the chance out and coming out into a different part of the country. It's always been in the back of my mind that I wanted to do that because, again, chiropractic down south is different than chiropractic in other parts of the country because you're allowed to do more in other states. So that process took me about a year total to be really comfortable. And then when I say I put in the most legwork for the process, it had to be about 2 months before graduation, where I actually started to apply for positions and actually start to like really hone in on networking and getting information from different doctors in like Maryland, Oregon, California, Colorado, Texas, Alaska, those Florida, all those states that I mentioned earlier, and being able to see, okay, what am I allowed to do here? What am I allowed to do here? What are they offering? Are they allowing me to expand my expertise? Are they just want to have me adjusting all day, or do they actually want to help me expand my scope of practice? And so that ultimately led me to taking this position out here. That way I can work with a doctor that specializes in sports medicine and is recognized by not only chiropractic, but the medical community in the world of sports medicine, and learn from him while I'm expanding my scope, gaining wider, expanding my expertise and getting a wider range of, just things I can put under my belt so I can progress. So I guess that answers the question.
Man, I love it. I love it. So it really
Yeah.
sounded like you had to. It didn't just come to you. You had to go get it.
Yeah.
You named Alaska. That all I needed to hear was Alaska, and I knew you was grinding.
Yeah.
And so from there, I wanted to speak on how's the process of passing. So I know you was named on different parts, and so one of the questions, I don't know if this is the same or have you already covered it, is how's the process of passing part 3 of your medical license? Because I know it's like different journeys into that. And so is that something you covered, or is that something that you're still doing?
No, so man, I did all of that in 2021.
Okay.
I took part 1 in 2020, and then right before COVID hit, and so then I had to take part 2, part 3, part 4 PT, and all of my
Okay, I wanted
organ
to make
exams
sure.
in 2021. So I had I took like 7, 8 exams in 2021. And so the biggest exam for me was part 4 of the national boards, and that was the part that I was kind of explaining that you have to pass the clinical, like you have to take all the information that you've learned throughout school and apply that in front of a group of assessors. Yeah.
So that's what I wanted to make sure, because I had him as questions. I was like, I think he said them. I wanted to just make sure I didn't miss it. So, and you also said that the process again. So, since that's a question, but you kind of explained it, but I wanted to piggyback because I remember you said something that caught my attention that somebody else may want to know too. So you said from state to state is different, especially from the north to the south. And so since you said, one of my questions was, how was the process of attaining or getting your state license? I'll just flip it because you kind of already spoken the process. What was the difference between the north and then the south, or maybe just state by state, of those different abilities you can do after becoming a chiropractor?
That's it's kind of a loaded question because then I'd have to get into like different state laws and like the history of
so I'll make it
chiropractic.
simple for you. Let's just do, since you went to school at Graham. I spoke at Graham, so shout out to the Graham fam.
Yes, sir.
But maybe just do Louisiana. So let's just do Louisiana compared to what you're at right now, Oregon. And so what was the 2 different laws and how do they differ?
Okay, so Louisiana is kind of similar to Georgia, where chiropractors are We're always allowed to be diagnosticians. If a patient comes in and we examine and we're able to, we examine, we do a functional assessment, neurological assessment, and then just the orthopedic assessment, running through tests, and trying to figure out if these indicators are positive for, these complaints. So chiropractic in that sense is the same. What I meant kind of earlier is that laws are different is with like treatment plans. So for instance, in Georgia, you're able to do, like, for instance, you're able to give PRP injections, which are platelet rich plasma injections, which just are stem cell injections drawn from your own blood. They centrifuge the blood, and then they kind of like let the cells settle at the bottom, and then they inject your own cells back into your joints to aid with reparative processes. But in Georgia, only like a physician's assistant. You have to have like a physician's assistant or somebody of that sort in the office in Georgia to do that. In Oregon, if you have like a naturopathic doctor, or if you have a doctor that specializes in sports medicine, like the clinic that I'm in now, then that doctor is able to do those procedures for patients. Another big difference is just the overall stigma behind chiropractic in the South. Again, what I mentioned earlier, like just YouTube chiropractic is where you see people that come in and they just get the straps, or they get this adjustment after this adjustment with no actual basis to, the care, which is fine. Again, chiropractic is a wide, like a range scope of health care. So, but for me personally, I wanted to not just only be that type of technician. I wanted to be a physician as well. So that's why I chose Oregon, and where is a state where you can you have the benefits of being a physician for patients. The patients can come to you in sort of I wouldn't say like a primary care, but in that sense almost, where you're able to do more extensive exams. You're also able to do more extensive treatment plans and care procedures for patients, kind of that you wouldn't be able to do in other parts of the country. And then other states are different, like New York, you're able to do those things. So we'd have to get into like the true like legalities of chiropractic for me to like truly give you a straight answer to that. But again, like it's just really just the stigma of how chiropractic is viewed by those committees in the South, versus how they're viewed by the committees in Oregon and Washington and New York and states like that.
Man, hey, it sounds like we need to get a part two.
Yeah.
But my my process would be, I want to make sure I'm saying it right. So how's the process for applying for jobs? So like say after, so it sounds like you're in your last step. So after you leave from your residency, is that where you're allowed to become a doctor and then have your own practice and your own? Is that correct? Or are you already in that state?
No, so I'm already a doctor. So
Yeah.
with chiropractic, the residencies are more so if you want to have a specialty. So for instance, the residency that I was interested in, there's two. There's the radiology residency, and then there's the sports med residency, and there's also like an internal medicine and a couple of other residencies. So with that being said, it's not like, so once you graduate chiropractic school, you're a doctor. In order to be a licensed doctor, you have to make sure that you pass all your boards. Once you pass all your boards, you have to go to the state exams. Once you pass the state exams, then you're licensed in that particular state in the reciprocal states. And then if you want to expand your expertise, that's when you apply for a residency. Those residencies come with like a different, like a completely different set of parameters. You have to pass chiropractic school. They take your transcripts. They make sure that you pass the allotted classes that were necessary for that residency. Once they see that and they assess your transcript, then they may give you another assessment so that you have to study for like an entrance exam for that residency. Once you get their entrance exam for that residency, then they place you sort like they do in medical school, and they place you in different parts of the country where there's an opening for you. The state that I'm in right now is that I'm already a doctor, but the position that I'm in is kind of unique. It's because it's kind of like a pre-residency. I'm already a doctor. I'm on payroll. I'm on staff. I see my own patients, but they, one of the questions that they asked me in the interview process is what did I want to do further than just regular chiropractic? Hence why I wanted to, that. Hence why I came out here so I can take a further step into the field of sports medicine. Um, so I guess I hope that kind of answered your question, because it's not
It
that
did. It did.
different, but it's, it's similar. I'm a
Yeah.
doctor now, and like I have a position. I'm in the clinic. I see my own patients. I can go wherever I want and care for patients.
Yeah.
But the position that I have is unique because it is like a sort of a pre-residency, because the clinic director and the staff want me to actually become that diplomate of sports medicine.
Mm-hmm.
So I can be that sports med chiropractic physician rather than just a chiropractic physician, if that makes sense.
I got you. So my question would
Yeah.
be, let's like break it down a notch. So for instance, do you feel like your journey would be easier if you knew probably in high school that, hey, I want to go this route. You had an expertise or a mentor guiding you from out of high school into college until you were now. Do you feel like that journey could have been easier and putting you at a better ease of knowing the way you want to go, or do you feel like your journey was just is what it is?
Honestly, I think my journey is what it is.
Mm-hmm.
And I say that because I had a totally different view of life coming out of high school. Then that view changed coming out of undergrad, and then that view changed again coming out of chiropractic school. So like having like that just one set view, I don't think
Mm-hmm.
that would have I don't think that would have benefited me, because then I would have been stuck to trying to like
Yeah, just
sustain
tunnel
that,
vision.
yeah.
Mm-hmm.
Being able to pick up a mentor later during that process rather than earlier allowed me to see and feel like that tight, that grip, like, man, I need to get to it.
Yeah, yeah.
Whereas if I would have had that coming out of high school, I would have been kind of more lackadaisical, like, okay, I know that's what I want to do, so I can go do or not do what I need to do
Mm-hmm.
to get there, because that's already set in stone. Like, that's what I'm gonna do. So regardless, I can take however long to do it. But putting that pressure on myself to say, okay, I need to figure this out, or at least this much out right now, that's just propelling me to just keep going and keep going. That sounds kind of psychotic, but man,
No, I know
like that, you
it
know what I
don't. It
mean?
don't sound psychotic. I get it.
Yeah.
Yeah, I get you. You know, I get you. If anybody
Yeah.
gets you, I get you. But from there, I want to ask, like, so if you had, say, if I was a high school student, all right, or college student, I'm like, man, okay, it's something I want to do, and so I just texted you, like, man, I need some advice. This is the route I want to take. What would be some pointers that you would give me, or not me, but to somebody that's reaching out for help? Like, okay, this is the route I want to take. So it would be like two things you'll tell them.
The first thing I ask them is are they sure? Like, you just got to be sure. And even if you're not sure, like, actually just make sure that at that moment, like at that point before you step foot on campus or into the classroom or actually pay to go, make sure you're sure. Like, just make sure you're sure. During that process, if you come to the agreement with yourself that this is not what I want to do, to each his own. Like, make sure that you're happy. But the first thing is just make sure. And the second thing is, I would say, is have fun. Don't slack off, but like have fun, because I saw a lot of people within my own program where they weren't having fun, and they kind of like, and a lot of people kind of like dropped off as it was going,
Mm-hmm.
because like I said earlier, the application process is different. Like, you can get into school fairly easy, but actually graduating and get through everything, because the stigma is, oh, okay, I got into school fairly easy, so getting through school might be easier, where that's not the case at all, because chiropractic school throws a lot of curveballs at you, for real. So make sure that you're sure, and then make sure you're happy, like, with your decision,
Mm-hmm.
and then during that process, make sure you remain happy during that process, because depression is real, insecurity is real, for sure, and then so just make sure that you're sure, and then
Mm-hmm.
the sky's the limit after that.
Okay, so I want to speak on that too. You said depression is real. All right, so make sure this. So depression is real. Also being that, like I spoke on earlier, just on the statistics of people that look like us inside the field. And so I
Mm-hmm.
bring that up just to say, being that depression is real, and maybe that you don't have people that look like you to speak to. Maybe in Atlanta you did, but say in Oregon you did. Just somebody. So what would be your advice to somebody like, So if they're in the journey by themselves, or what would be like 1 or 2 pointers knowing like how you made it and how you got through to be where where the point that you are now. So what would be something you'll give to like uplift somebody to be like, all right, man, it's hard right now, but it'll get better later. So maybe just for instance, me, and I'm in a situation like, man, I'm down, I'm not feeling it. I'm sure about it. Like this is the process I want to go, but it's not it for me right now. I'm just not happy about it. What would be some pointers or just some words or uplifting words you would say just to get me through that this tough spot?
Honestly, I would say if you need to take a step back, take a step back. You know, once you're in it, like it can be overwhelming. You can get flummoxed with a lot of things. So if you need to take a step back, take a step back. The good thing about the particular school that I went to, and I'm not sure if it's the same with all chiropractic schools or doctorate programs, but they help you modify your schedule so you're not bogged down with coursework all day. So if you're in that situation in the school where they help you modify your schedule, I would say go talk to your advisor, get your schedule broken down. That way you're not on campus. Because man, there were days that I was on campus from 7 a.m. to 7 p.m. and then had to go home and study for boards. You know, so it can get a lot to you, and so and it's a lot of information that you take in, and then there's a lot of information that seeps out, and it kind of puts you in sort of a imposter syndrome sort of place, because it's like, dang, I know I studied that, I know this, but it's just a lot right now. I can't relay it. I can't convey that to a patient, or I can't take it from my mind and put it on a piece of paper for a grade, you know? So I would say that if you're feeling down, consider taking a step, like just taking a step back, taking a break, man. That's perfectly fine. Life is long. Even though it's short, it's long. You know, so yeah, take a step back. And another thing I would say is that if you're in the program, you're never alone. Honestly, you're never really alone. Honestly, man. There are more, I would say, empirically, like just for myself, just the things that I was able to see is that when people were down, it was pretty easy for them to find like their niche, like their clique of people, because you're not the only person feeling like that. There should be, there should be, and if there aren't, then that's bad on the institution that you're in. But there should be parameters in place where if you're going through some of those effects, you should have somebody to talk to. At our school, we had people to talk to. We had not only students, but we also had faculty to talk to. And then again, my mentor is not only just my mentor; he's a lot of people's mentor, where he links you with other doctors of color, or just other, or just plain other doctors, where he knows them personally. So, okay, I know this one doctor that went through some sort of similar to what you were going to. So I'm a, link you with them, and y'all chop it up, y'all, run into each other and see what's going on. And more times than not, man, that helped. That definitely helps. So those two things, man, take a step back, and then also you're not alone. Just remember, you're not alone, honestly, especially if, and then you said, like, for instance, like you're that person, like if I'm there talking to you, you're obviously not alone because I'm there talking to you, trying to uplift you. So yeah, I hope that answers your question.
I love it. I love it. And so I always like to leave it to where if you had a question, I know I've been asking you questions all day. If you want to ask me something, feel free to ask me a question. But I want to,
man,
you do?
Oh, no, keep talking.
No,
Yeah,
I
I
was
do
saying because you had said life is not. You said something. You was like life is long. It was something I wanted to piggyback. Oh no, you said to have fun. It was something I learned. I was reading an audiobook. I forgot the name of it, but they were saying like create that burning desire for what you want. It's almost like a rapper. I put it like this. It's almost like a rapper. Once you catch the beat, then you're on flow. So they took that perspective and put it into life. Once you catch the beat of your life, you're on flow with what you want to be. And then from there, like what you said, figure out, be sure of what you want to be and be sure of what you want to do. And then once you catch that flow of what you want to do, have that burning desire. But sometimes diving in 24/7 might not be the answer. Sometimes, like you said, take a step back. Man, take a walk, go to the park, go somewhere, take a step back. And sometimes it comes faster. Once you put it in, then still back, if you'll come back and realize like the answer be right there for you. And so I was piggyback off what you said, because I've seen it, especially what I've done, what I've been trying to do. Like I'll go all in and let me take a step back. Let me just chill. Let me go call my mom or call my brother. Just try to do something like that.
it's sort of like you get out the shower and you got the door closed, shower running, and then you look out the shower, the mirror's foggy. As soon as you open the door, you take a step out of the shower, you go do whatever you need to do around the
Mm-hmm.
house. You come back, and then the mirror is clear. You know, all that steam has come out, all that fogginess is gone out the way. Just so, like, think about that, man. Take a step away from that. Just like you don't watch a kettle burn. You don't watch a pot boil or a kettle
Yeah.
boil. You know what I mean? It'll take forever. So as long as you take a step back, like you assess yourself, like assess your your like intuition, like or whatever you want to do, then if you come to that agreement that you want to go and still and keep attacking, as soon as you go back and you actually go and look and attack, you'll see, okay, this is the avenue I want to take. I was blocked. I had a mental block earlier, so that's easier than I thought it was. It was a plenty, man, and I can only speak from experience that, man, there was plenty of times where I was sitting there studying for boards and it just wasn't sticking. It just wasn't sticking. I take a step back. I go to the gym. I call somebody, chill with somebody, like just think to myself, like, man, do I really want to do this? And then back of my head is like, of course you want to do this, man. You wouldn't be right. You wouldn't be right
You
here.
wouldn't be right where you at.
Like, you
Yeah.
know what I'm saying? You wouldn't be thinking, do I really want to do this? If you didn't want to do it, you just close it and just say, I don't want to do that and walk away.
Yeah.
But the
Mm-hmm.
fact that you're putting yourself through that all day, every day, just shows to how much drive and just ambition that you have to get through it. And that goes in every aspect of life, whatever your occupation is, man. The fact that you wake up every day to get to it is fact enough, man. It's evident enough that you're that whatever path that you set out for yourself, you're on it. It may not be that path that you're looking at every day, but one day I promise you it's gonna switch to you, it's gonna switch for you, it's gonna come to you, you're gonna be like, that's what I want to do.
Man, I feel like the word for that, I'm gonna screw it up. I'm telling you, it's called like splendidity, something like that. It's called like splendidity, where you can go all into something and then you still back and you'd be surprised how fast it comes to you. I gotta look at it. I'll put in. So I'll make it on my YouTube channel. But it's actually where I read it in the book. If you wanna, it's a book I leave with. It's called How to Achieve Anything You Want But Faster. And in that book, like chapter, I think it was chapter 8 or chapter 12. That's what the word he brought it up. It's called splendidity, something like that. But the definition of that basically is just saying that, like we were saying earlier, don't watch the pot boil. It's gonna happen. So you putting all that work and you still back, it's gonna come back because it's just cause and effect. It's just like when you're doing a bank account. The more you stack into your bank, the more money you deposit in every single day. Man, when you look into your bank account, bitch, you go, oh, I got a couple dollars in here. You feel me? That's the same with life. Like you said, you was depositing. Serendipity, that's what it is. I can't yeah, that's what it is. Yup. Yeah, I told you I was gonna screw it up. Hey, I knew I read it though. I be reading. But no, but if you want to ask me something, you can always ask me a question.
Yeah, man. So, man, it's been a minute, man. How was that for you coming from Calgary to going to Oklahoma, man? How was that whole process with you, man? Playing with all those athletes, man. I know when Murray was there, Baker was there, who else, man? Jalen Hurts came, and then of course you was there, man. Of course the city was all behind you, man, and you was lit. For real, man. So how was that? I'm really excited to ask you that.
Yeah, man. So I tell you, that kind of shaped what I do right now in my foundation. Mm-hmm. The sole reason of how I speak to the kids and what I try to do with my foundation is, the reason why I say that is because I walked into a place that was built on a culture. It was rated as the #1 program to ever exist in college football. And that's just not by accident. You feel me? That's by consistency. Mm-hmm. And so just walking into a place of culture, of constantly seeing great people come in and out, constantly seeing people chase perfection, constantly, man, we came in, I was 18. I was just turned 18. I'm walking into it, man, you thrown into the fire, like what you gonna produce. And so from there, it creates that greatness in you, because either you're gonna produce or you're gonna fall off. And then from there, it's the same in the classroom. They're not gonna just let you step up on the field if you're not showing up to class, if you're not showing up to workouts on time. I'm waking up at 4 in the morning, at like 4 a.m. for the whole spring semester. I gotta go to bed. I wake up at 4. I gotta go to bed at 8. I'm like 18. I gotta go to bed at 8. Got to. I mean, we're doing 2 a day sometimes, but it just creating that culture inside you. And then we still gotta go to class. I graduated. Yeah. A lot of people don't know. I graduated in like 2.5 years with my bachelor's. And doing that. And but at the same time, it's like it just creates like that greatness inside you, just to know like, man, I can do anything. And while doing that, I still became the bruh. So I look
Yeah.
back on it like, dang, how did I even do that? But it's just because I'm around people that was chasing greatness. I'm around people that was Heisman winners, #1 draft picks,
Yeah.
uh, Super Bowl winners, things like that, playing the Super Bowl, but they just woke up every day consistently chasing that grind. Like you said, sometimes they're like, man, do I want to do this? Is this it? But they'll take a step back like, man, I wouldn't be here if this wasn't it. I wouldn't be in this position if this wasn't it. But just constantly just being around people where we always just thought the same way. And you realize once you get around other people, they don't think that way. A lot of people don't think that way of just consistently every single day chasing something. That's not common. And so, but that was common at the University of Oklahoma. And so that's what I try to preach with my foundation, and what I try to bring back to the city is just a culture of this consistency, chasing something every day, just
Yeah.
finding a reason to live, finding a reason to have purpose. Because that you will see in our communities, a lot of times, like, people don't believe they can be anything. Like, you don't even have to have life figured out, but just have the ability to know you can be anything. Just know, like, man, just chase something, man. Like I tell, if they want to do football, I'm all for you playing football. Let's do it. At least you're waking up and you chasing something, and that's going to get you somewhere farther. Because if you in order to chase football, you got to still be good in classroom. So be great. So that's what I try to teach, and that's what I try to preach. Because that's what I learned at the University of Oklahoma.
Yes, sir. Yes, sir. Man, that's kudos, bro. For real. I did have one more question. So with this whole foundation, like, what is your ultimate goal with it? Like, what do you want to, like, how do you want to expand it? Like, what are all the things you want to incorporate into it?
Okay, so that's a good question. So with my foundation, I say the ultimate goal and what I see, that's a deep question too. That's like a whole nother live segment, but I'm gonna try to break it to you real simple. So to break it simple is when I seen the movie Black Panther. In the movie Black Panther, at the end of it, if some people hadn't seen it, the reason why it was an antagonist character and a protagonist character, as it was two people that were fighting against each other. You had the Black Panther, and then you had Jordan, what's his name? Jordan Love, what's his name? What's his name? The actor? Yeah, Killmonger, that's his name. Yeah, Michael B. Jordan, that's his name. The reason why he was mad at Wakanda Black Panther, because he grew up in Oakland, and he was saying, y'all have all these resources for y'all people, but y'all not bringing these resources for our people that's struggling. And so at the end of the movie, once he kind of seen what he's talking about, like, man, he had a good point. I said, I'll be mad too. At the end of the movie, they put the Black Panther hub at the end of the movie. He saw like the resources were being put from Wakanda into the Oakland community for their kids to be able to. So when I seen that, a light bulb popped. I was like, man, I gotta do that. That's something I want to do.
Facts.
And then from there, I typed the paper for when I was doing my master's for 9/11, and why 9/11 was just such a tragic event. To make it short, they didn't have a fusion center at the time as they do now. And what a fusion center is just a way where they relay messages between all the Department of Defenses. It's 14 or 16 of them. And at the time they didn't have them. So it was just lack of communication. So with lack of communication, you have a slow progress of things to be done. And so I was like, man, that's something I seen within our community also. And so I was like, man, imagine if you created those two things inside of just one. And so that's how I kind of got my foundation. I wanted, because I seen in our own community, we have like people just as you. We have people that make it out in many different areas, football, basketball, doctors. I didn't talk to mayors, crypto, blockchain, race car drive. I can name a million different things that we done, but you wouldn't even know that we done it. We did that because a lot of times people don't know where to put their time, their resources, their money, or just their knowledge back into the community. And so I just wanted to create a foundation where it could be an outlet for us to all just connect whenever they want to come back home to the city, or not just our city, but any under-resourced community, to come back home and get that knowledge back, to know, we are doing great things, these things that can be done. And a lot of times people don't have that time to put their efforts into the community because they all doing it on great things. So having an actual foundation that can do that, because like we seen with the Amazon incident with Black Lives Matter, like I feel like they started off good, but they weren't doing what they needed to be done. Like they had plenty of money, plenty of resources, plenty of people to make a change, but it really was just a hashtag at the end of the day. And so I wanted something that could actually create change and create a positive change in the community. And that's how I kind of came up with the foundation, and I have 15. I always preach on the 15 programs that I came up with. Well, not just I came up with, that I've worked with people on the foundation, the people I worked with that want to do it inside the community, and those programs to help uplift under-resourced communities. And so that's kind of how everything is. And so, like, for instance, I was just with BT Dub and that Booker T creating these programs to put into the high schools, to where, like how you said, STEM research, coding, robotics, college readiness, and also life readiness for after high school.
Yeah.
So creating a path to where everybody can go to college, everybody don't need to go to college, but everybody can be world changers. And so just creating a path for our next generation to where it's not just only 2 of us on this live, but if it was a room of 10 black men or black women, man, 8 of us will make it, 10 of us will make it.
Yeah.
But because we all on that same path, we can, like I said earlier, we creating a culture of greatness, and that's what I kind of want my foundation, creating a culture of greatness within our community.
Man, you hit it right on the head. Taking those resources and giving those to the under-resourced, under-served. Yeah, man. That honestly, you answered all the questions with that one, man.
I told you, it's a lot more. Like I tell people all the time, like Jeff Bezos is moving boxes, but he didn't tell you that he wanted to go to the moon. So there's a lot more that is with it, but that's really just the raw emotions and the raw basis of it. And so that's why I made it. And that's been a journey I've been on.
Yes, sir.
Yes, sir.
Dang. Thank you, man. Thank you for having me, man. For real.
Nah, no problem, man. It's been a minute since I seen you, though.
Yeah, man. Hey, you bigger than me now, man. But yeah, I still give you on the field. I still give you that work.
Yeah, crazy. Nah, but I really do appreciate you coming on. I didn't know you was going that hard, though, Doc. I gotta start calling you Dr.Chop, for real. Dr.Chop. I like that. Dr.Chop. My man, the whole doctor out here. That's why I love to see it, though. Love to see it. Love to see it. Man, if you had one thing to give back, if you just had just one knowledge drop, just one jewel, what would you give back? What would you say?
I kind of said it earlier, man. Just be happy. Just be happy. Honestly, just be happy with everything that you do. Just make sure that you do, just make sure you're doing it with just complete happiness or reserve, just content with yourself. If you don't, then it'll be prevalent later. It'll start to show later. Kind of like that old adage that whatever's done in the dark comes to light. So if you're not happy when you're like in the dark, if you're not happy, then you're not going to be happy once that light hits you. You're gonna feel like an imposter for real. Like the grind is gonna get you there for real. But if you're not happy during the grind, then you're not gonna be happy once you attain that. So just be happy for real.
Man, I can attest to that, bro. I know exactly what you're saying. So that was positive. That was positive. That's positive.
Yes, sir.
Man, I appreciate it. I can talk all day with you. I might just get you on FaceTime. I had to catch you on FaceTime. We'll talk all day. But man, it was amazing to talking with you. I'm glad to have you in my circle. Amazing man, an amazing figure. I'm glad everything you're doing inside this just Louisiana community, but worldwide. Put it on out there in Oregon. Dr.Chop. I'm gonna keep saying it because you earned it. My dog, Dr.Chop. Love to hear it.
Yes,
love
sir.
to see it, man, and keep doing it. I know you got people looking up to you, not only in your family, but in the community. Man, and not just on the OneMindSet Foundation, but man, I'm proud for you, and I can't wait to see you do more big things.
You too, yes, sir. Remember, one mindset.
Yeah,
gotta have it. Yeah.
I'm gonna send you a shirt. I gotta send you a shirt.
All right, bet. I'm gonna send you my address, man. I got you.
Okay, bet. Appreciate you.
Appreciate you, man.